nations the globe over are anticipating the possibility of relaxing COVID-19 protective limitations. However, as the United Kingdom prepares to suspend its own pandemic restrictions on July 19, major doubts are being raised about the logic of such a policy shift during a period of escalating illnesses. Is the UK, then, attempting herd immunity through a mass infection? Over 1,200 scientists wrote an open letter to the Lancet medical journal condemning the government's practice as an unscientific and unethical reopening policy and herd immunity through mass infection. The letter's harsh tone reflects widespread apprehension over the prospect of a full reopening. Over 500,000 individuals have been asked to self-isolate in the last 7 days as cases of the Delta variety spread fast across the country. Wary of the speed with which restrictions are being eased and skeptical of the effectiveness of what the government has described as a shift away from the government dictate and toward personal responsibility, many transportation authorities are insisting on the continued use of masks and social distancing measures. Numerous businesses have chosen to implement similar measures, with Sainsbury's and Tesco supermarkets supporting mask wearing and JP Morgan announcing that personnel would continue to be urged to wear masks when traveling about their Canary Wharf offices. Sajid Javid, the recently appointed health secretary, was diagnosed with the illness over the weekend, forcing Prime Minister Boris Johnson and Chancellor Rishi Sunak to isolate as well. Rather than the anticipated euphoria accompanying Freedom Day and the removal of limitations, UK media published titles such as Freedom Day and references to a pandemic, as the number of notifications from the National Health Service's Test and Trace app continues to increase. However, it seems improbable that the government intends to pursue herd immunity for one simple reason: it is not technically viable. Professor Paul Hunter of the University of East Anglia, speaking to News, emphasized the statistical futility of such an endeavor. The AstraZeneca vaccine is approximately 88% effective against clinical infection with Delta and potentially less effective against asymptomatic infection. We do not know the total number of infections caused by the Delta variant, but 67 in the Phase 3 experiment before Delta. Therefore, 88% of the population would need to be immune to achieve herd immunity. With a vaccine that is just 70% effective, you would need to immunize 125% of the UK population. Despite the increase in incidence, hospitalizations and mortality remain minimal. However, Professor Hunter notes that herd immunity is not required because the vaccines significantly reduce the risk of contracting a serious disease on the first infection. COVID is here to stay, but not in the way we know it, more like the other coronaviruses that cause the common cold. With an unequal worldwide vaccination program, new variations will likely continue to emerge. Perhaps it is this truth that lies at the heart of the government's justification. Economies cannot remain closed indefinitely when their treasuries are starving of tax income. Additionally, populations are likely to get restless at the possibility of continuous curbs, especially with the threat of civil disobedience always there. This may be said to be the calculation made by Number 10, a decision made to safeguard the economy and preserve the option of subsequent lockdowns for later in the year, should a new vaccine-resistant variety arise. Adherence to this policy, however, will be difficult. As with the UK public, other nations have expressed grave reservations, with Germany characterizing the policy change as a very hazardous experiment. Actually, the UK and other countries are unlikely to achieve zero COVID-19 deaths. Government and scientific experts will have to decide an acceptable number of deaths, a decision no leader wants to make.